So when I first started taking care of patients with connective tissue disorders over a decade ago, I recognized that these patients are complex. They have a lot of different organ systems that are involved. They require care by a host of different specialists, whether it's a cardiologist, dentist, nephrologist, orthopedic surgeons, and so forth. And that puts a lot of stress on families. Families have to try to navigate complex medical systems where they're being seen at different places, different times. The plans are all different. And so in looking at that, when I first went to Arkansas, my goal was to build a multidisciplinary clinic where we would reduce the burden of the disease on those patients and provide everything in a one-stop shop sort of model. And so we did that. And then moving here to Palo Alto, we've brought that model here and introduced that. So now when we look at these patients and we have them come in for care, it's a different sort of approach. Really, our vision is to provide all-encompassing care in one day, one place, with one plan. Everything unified among all the different providers. We have a cache of 10 different providers that can be seen through our clinic on the same day. Thankfully, not everybody has to stress the system by seeing 10 different providers. Most of the time, they will see 5 to 6 different specialists in one day, get an echocardiogram, x-rays, ultrasounds, and so forth. And then all those providers communicate with each other to provide a unified plan so that at the end of the day, the family gets a printout of exactly what everybody's recommendation is for their child. So they know exactly what the plan is going forward, and they're a part of that. So our team is comprised of a host of different specialists. Again, we have up to 11 depending on a given day. Usually we have 10 sort of at the ready. And each patient family completes an online questionnaire and then requests to be seen by whichever specialist they feel would be necessary. And so we custom tailor their clinic day for them so that they're being seen by all the specialists that are needed. And if we decide that, hey, you know, it might be important for this patient to see an additional provider, we'll actually work that in if we can. Most of the time we're able to accommodate that. It allows the providers that are in the clinic to actually learn more about that given process, and so that everybody's expertise is elevated as a result of this. It's something that I refer to as the virtuous cycle. So the more that we see the patients, the more we know about the patients. The more we know about the patients, the more we actually can ask meaningful questions through research and so forth, that we develop further knowledge. More patients come because they know that we've got more knowledge and more expertise, and then this cycle just continues to repeat itself. So the multidisciplinary approach in this manner really is the tide that lifts all boats, if you will. I think that a confirmed genetic diagnosis for a given connective tissue disorder is very important because it helps us to know not only what are we dealing with, but what does the future look like for these patients. Because each connective tissue disorder, though related, is different, and the manifestations in the cardiovascular system, for instance, are different. Though again, they do have similarities, they're different. And because of those differences, our surgical thresholds and thresholds for interventions, whether in the cath lab or otherwise, are different. And so if we don't have the diagnosis correct, we may be operating under an incorrect sort of paradigm as it pertains to management. So I think that it's really important to have a confirmed genetic diagnosis in any connective tissue disorder. To that end, our approach here is to make certain that pretty much everybody that comes to our clinic has a confirmed genetic diagnosis, because we want to be sure that we're actually treating what we think we're treating, and we're treating it under the best possible guidelines for that process. So if a patient were to present to a specialist and there is some diagnosis in their mind of a possible connective tissue disorder, I would recommend that they refer that patient to a center that has expertise in connective tissue disorders, because it's important, again, as we talked about earlier, to make sure the diagnosis is correct, because that impacts what sort of therapeutic planning and intervention algorithm you're going to be utilizing for the care of the patient. Genetic testing can be ordered and interpreted on some level, but that doesn't provide expertise and understanding of how those diseases play out over time. And so I think it's very important to refer to a program that has a high level of expertise in these complex patients. The first patient that I saw with arterial tortuosity syndrome was striking. The arterial bed is entirely different than just about any other process that I've seen, and I've seen a lot of patients with connective tissue disorders. It shares similarities with some, just it's much further along a disease spectrum in a lot of ways than some of the others. And so I was struck by that, the arterial architecture, and recognized that this would take a lot more thought and planning with regards to care than would typically be needed for a lot of different conditions we care for. And so that was the first thought that I had. Patients with arterial tortuosity syndrome have a certain facial phenotype that is unique, as most of the connective tissue disorders have. They all tend to have a certain set of features that is unique to them. And so patients with arterial tortuosity syndrome have similar kind of facial features with down slanting palpebral fissures, or their eyes sort of turned down, sort of a broad face, usually loose joints and skin that is a little atypical, translucent a lot of times. So those things coalesce into this sort of phenotype that then when you see the vascular tree really points toward that diagnosis. I think it's really important that we advance the field of care for patients with ATS. I think that there are a lot more things that we don't know than things that we do, and so that's going to require collaborations with regard to research. There are a number of different institutions that are beginning to coalesce together to work together, but this condition is rare. It's much more common for people to be what's called a carrier at this time, but for patients to have what would be called a homozygous sort of issue, it's really rare. And because of that, any one institution isn't going to have a huge amount of experience with that. And so it's going to require that we work together. And I think that it's going to require that that be driven on some level by patients and their families. Working with one single entity like a Twist of Fate, I think, is imperative, because there needs to be one voice for patients and families that are affected by ATS. Otherwise, it's a lot of noise. If everybody's trying to say something, not much gets said. There needs to be a unified voice. And having an organization like a Twist of Fate to lead the way, that's already built inroads with a number of different organizations, is just efficient. At the end of the day, you're going to be dealing with a lot less bureaucracy and things of that nature, because those doors have already been opened and so forth. So I think that the idea is best to try to unify under one sort of umbrella, and I think that a Twist of Fate has been leading the way with that, and so that makes the sense to me for that to continue to be the champion of arterial tortuosity syndrome.